I see many patients whose spinal discs have degenerated. Well, what does that mean? Discs tend to degenerate over time. As they degenerate, two things happen. The nucleus, or the soft core, dries out, starts cracking, and starts resorbing. And the disc space that has a gap between the two vertebrae, which is where the disc sits, decreases in size. As it lowers down, you see people get shorter. I had 3 degenerative discs in my back. I had 3 artificial discs placed. I got 1.75 inches taller. So the height of the disc will collapse as discs degenerate. It can pinch nerves, causing leg pain or sciatica, and in the neck, arm pain or radiculopathy. So different things happen as discs degenerate. Some people have a lot of spinal pain related to the degeneration. Some have no pain related to the degeneration. Everybody's different.